So good morning, everyone. Thank you so much for allowing us to be here today. My name is Mathew Barewicz. I'm Economic and Labor Market Information Chief for the Vermont Department of Labor. What I'm trying to convey, first and foremost, is that if there's anything you're taking away from this discussion, it's that you know that there's someone out there who tracks this data, that there's someone out there who works on workforce development issues, and then if you come away with one thing, it's how to get in touch with us, right? We're going to start a conversation today. We're not going to end a conversation today. We're going to discuss problems today. We're not going to solve all the problems today, but through collaboration, through partnerships, through partnering with the Department of Labor, whether it's learning more about the data we have, partnering on future data products, or workforce development, developing training programs, working on internships, whatever that might be, or apprenticeships, whatever that might be. These are the solutions, these are our areas of expertise, and always looking to have conversations, always looking to partner, always looking to do things. So we'll reinforce that point as we go forward in this discussion, which is knowing that we're a resource to anyone who wants to partner with us is really the biggest takeaway we can provide on this. As background to who I am and what I do, I oversee the Economic and Labor Market Information Division. Though we are state employees, we are 100% federally funded by the U.S. Department of Labor. The bulk of our money comes from the Bureau of Labor Statistics. What's up, Jesse?
Hey, how are you?
Good. Bureau of Labor Statistics gives us money to compile, collect, and analyze data consistent with federal methodology so that we're using the same definition as nurse as the state of California is. We're producing wage rates in the same way that the state of Texas is. And this includes labor force participation, unemployment rates, all these federal definitions, much like people in healthcare who have technical definitions on certain terms, right? Universally, you know what that means. When you're speaking to like-minded folks, same with us. When we say unemployment, I think specifically the federal definition of what unemployment is, not around the Thanksgiving Day table of being unemployed, which is more of a folksy term. So the Employment and Training Administration, they give us a small pot of money to say, you have great data, now go talk about it. This is, again, the partnerships, right? So for example, through the Employment and Training Administration, we've had an internship program, which has been invaluable to our department or our division to actually do more work, create positive work experiences for young people in the state of Vermont, but also a pipeline for us down the road. And we've hired several interns to be longtime employees with the Department of Labor this way. But as an example of the partnership through this internship program, this summer we partnered with the Agency of Human Services, specifically around workplace safety, around what are it's not safety, they have all these terms of arts that I was just learning as part of it, but like do employers promote stopping smoking cigarettes? Are they capable of providing substance handling or supporting individuals with substance abuse or disorders? What are they doing to promote physical activity in the workplace? These type of things. So a state partner reached out to us and said, we don't have a way of collecting this information. We want to know what Vermont employers are offering their employees as it relates to health and wellness. And we said, sure, this would be a great opportunity for us to partner with that. And so through that internship program, we're able to do these. So the research of that under what we call a fringe benefit study will be released in a couple of months or so. So again, just kind of an example of how we can partner. So. All right, we are going to be moving forward. We'll have some fun. Let's get this dialogue going. Let's get some activity. And this is all going to kind of fuel into a conversation and hopefully get people's minds going about the issues in the state of Vermont. So let's do a quiz. How many people in the state of Vermont? 626. Yeah, look at this on the nose. I'm hearing 625, right? 625. It's really interesting to get the population counts in the state of Vermont because we're really good at it doing every 10 years. We're terrible at doing it in between those 10 years, right? The U.S. Census Bureau is historically bad about estimating our populations. They thought by 2020 we would have well over 750,000 people, and that forecast was proved to be quite wrong. I mean, we got a couple of years, but we got 1 year, I guess, to grow up by 150,000 people. I don't know if we'll get there. But it has a lot to do with our demographic composition. Specifically, we have a large cohort. We are a significant importer of pre-college age students, and we're a significant exporter of post-college age students. And when you put that many young 20-somethings in an area, the U.S. Census Bureau says, oh, population growth, and they start churning out all these new people that never materialize. So this population, we've even seen it up or down in the last few years, but it's just, again, we are a small state, but Relative to cities, how many cities do you think are bigger than the state of Vermont as far as population? 80, yeah, right? It's not as many as you think, 27. So there's only about 27 cities that are actually bigger than the state of Vermont. What is the concentration of people in Chittenden County? Yeah, it's about a quarter, right? So when we talk about Vermont, especially as an economy, and we can talk about the economic factors that make economic growth, and that'll be something that might be interesting as we go forward in this discussion, but people are a big part of it, right? And so Chittenden County sometimes gets tagged as the economic engine of the state of Vermont. Well, it accounts for a quarter of the people. And the way my division looks at areas or regions, we actually look at labor market areas, which are defined by, in partnership with the federal government. A labor market area is defined by where people live, work, and commute, and like kind of shop. So it's kind of those three: work, live, shop. So your commuting patterns. And so if you actually look at the commuting pattern around Chittenden County, the Burlington, South Burlington labor market area goes up to Swanton now. It goes into 5 towns in Addison County. It covers much of Grand Isle. And you start looking at that as the labor market area where people live and where people work, how they're commuting down 89. If anyone's seen 89 South coming from St. Albans into Burlington in the morning or north at 5 o'clock on a Friday, you see that population moving. You see those people. And that accounts for about a third of the population of the state of Vermont, and 40% of all the jobs are found in the Burlington, South Burlington labor market area. Again, that's bigger than Chittenden County, the labor market area, because it incorporates so much of Franklin County. But you're starting to see that there's a big concentration of people up there. How many people are from the Chittenden County area, the Burlington, South Burlington area? Okay, so we actually have some people that are not, so that's good. We want to mix. We want to have this conversation not in a vacuum. Because when we're talking about this urban-rural thing, I think I heard some discussion earlier about this. The urban-rural thing has been something that economists have been watching. What's up, John? I've been watching a lot lately, trying to figure out what does it mean? What does urban and rural mean these days? So, for fun, which of these are towns in Vermont? Albany? Yes. Yep. Troy? Yes. Athens? Yes. Yeah, it's getting quieter, but yes, Athens, Vermont. Halifax? Yep. Winterfell? No. Any Game of Thrones fans here? So, yeah. Montgomery? Yes. Baltimore? Yes. So you're seeing this, like, Vermont has so many small areas, so many small towns, vibrant communities, not part of the Burlington labor market area. And from a healthcare standpoint, these are all areas that need healthcare, right? We understand the challenges associated with concentration and population densities around the delivery of healthcare or around the delivery of any service. So we're going to whip through this quiz. It's almost done, I promise. Then we'll get into the real lecture portion of this presentation. Per capita income. Do you think Vermont's above or below? We hear the stories all the time. What do we hear about Vermont, the Vermont economy? What's happening in the Vermont economy right now? Right? What do people always say? Yeah, we're losing jobs. We're losing people, right? You know, can't make any money, right? You know, so per capita income. You think we're above or below? Yeah, we're above the U.S. We've been pretty consistently just above, not huge. Average hourly wage, we are below. Median hourly wage, again for the statistics, the average, just taking the average of everybody, the median is the middle point, we're above. And this is where you start seeing like kind of like the political philosophies. Some people will say, you know, we have a higher minimum wage, so we're gonna boost up the lower parts. We don't have the industry composition to really take the average, you know, so the Oprah Winfrey effect, or what's now known as the, what's that guy from Amazon? Bezos, the Jeff Bezos phenomenon. You know, all of us have quasi-similar incomes. He walks in, it takes the average way out. You know, we don't have large sports teams. We don't have major financial centers. We don't have massive tech companies or headquarters that are driving up the average hourly wage. But as a concept, our median is above. So per capita income, you're seeing this kind of all fall in line, you know, with this opportunities. And so some of the challenges of the Department of Labor is when we talk about convincing people, there's jobs out there. And yes, these jobs actually pay. And you're trying to encourage people to look and partner with us to help make those matches. Labor force participation, I think we're above or below. We're above, yeah. I'm not sure where this comes from, but we have a significant higher, in addition to having significantly higher labor force, meaning people who want work, are able to look for work, they're able to find it too. Our unemployment rate is lower than the nation's overall. We have the lowest unemployment rate in the country. Burlington has the lowest unemployment rate for any metropolitan area in the country. And this dates back to throughout our history of being able to report out an estimate for the state by month. This is the lowest monthly estimate of unemployment rate in Vermont's history. So we're talking about a period of time, which is rare, unique, in that we have extremely tight labor market conditions. Anyone in charge of hiring out there? Anyone have to deal with that? How's that going for you? It's tough, right? You know, we had a posting, and by the end of it, we're like, we don't think we can move candidates forward, right? We'd rather stay where we're at than take a chance. And, you know, and this being coming from the Department of Labor, and we understand that there's opportunities to partner. Hopefully Sarah will get into that. Bonding might be a good conversation. But this is where we're at. Labor market is tight, and a lot of it has to do with the economic activity that's occurred, and we're gonna get some good spaghetti charts, because these are fun. But I really thought this group would benefit from it because I'm gonna break it down. And this first one is just a primer to kind of get us understanding the concept. And then I wanna show a couple ones that are gonna be more meaningful to this group. But really what this is every recession in the United States, so this is US data, standardized into percentage terms so that each economy is the same. Every recession since World War II, what they call modern economic history. So left to right is time, number of months, and up to down is percent of job loss. Again, so since it's in a percentage standpoint, you can compare a 1950s economy to a 2010 economy because it's in percentage terms. The reason they called this last recession the Great Recession is because of the depth. You can see how deep this recession was. 6 out of every 100 jobs were lost in the Vermont economy. 6 out of every 100, US economy, talking US. 6 out of every 100 in the US economy was lost. And then you look at how long it took to gain these jobs back, tremendous amount of time, longer than any other recession. Normally it's up and down, right? So deep recession is what this is considered. When you add, so the blue line coming over is the US again, but we've added Vermont to this. So the most recent recession, and you see Vermont lost 4 out of every 100. So for every 100 jobs, Vermont lost 4. For every 100 jobs, the US lost 6. So we did not get as low during the economic downturn. And then you're seeing we are not growing as fast during the economic upswing. The US is a much hotter engine. It goes faster and it goes cooler, much more than we do. But where the story, again, bringing back this rural-urban divide, if we take Vermont and we separate it out into 2, we can separate out into the Burlington, South Burlington labor market area, again, covering much of Franklin County and Chittenden County, and look at how they fared, that area of the state, relative to the rest of the state. So you hollow out the northwestern corner of the state and you're left with the rest of the Vermont economy, and you'll see that the rest of the Vermont economy is barely getting back to where it was on a job standpoint compared to 2007. So we're talking about one of the longest period of economic growth in modern US history, right? So the US economy has been growing. It's been slow, but it has been growing for many, many, many years. But there's parts of the state that are not experiencing any of that growth. And in fact, if you compared to where they are now, relative to 11 years ago, they have fewer people in the workforce. They have fewer jobs in their local communities. And this is where, when you start hearing conversations about rural areas of the state, specifically in healthcare, you're seeing the crunch, right? Because this is a count of filled jobs. If you have 1,000 unfilled jobs, they're not going to show up in this data. So it can be less of a factor about, well, it doesn't even matter at the end of the day whether there's nobody to fill the job or the job isn't posted. The economic activity isn't going on, the services aren't being delivered, and then you're having to make decisions about scarce resources, which is what economics love to talk about, scarce resources. And what I'll point out to people, especially if I'm in a not Chittenden County area of the state, is I'll point out that this bottom line, the Vermont excluding the Burlington area, is buoyed up in some regards by the Montpelier-Barre micropolitan area, which is doing quite well. If you actually look at the employment growth between Barre up to St. Albans, that's your economic corridor of economic activity going along 89 right there. So you actually, if you remove the micropolitan area of Barre and Montpelier, this line gets even worse. Right. So now you're saying the Northeast Kingdom, all the southern counties, you know, it's a much tougher picture. So we are totally geared for spaghetti, right? So this is where it's at. And I'm going to highlight. So don't worry, we're going to highlight this. So as an economist, we love to think about why did the recession happen? What made that go? You know, we're really good about talking about what happened in the past. We're not so good about talking about what's going to happen in the future. But we like to think we get it right sometimes, or through just open, honest dialogue with informed people, like people in this room, we can put together some sort of strategy or way to weather an upcoming storm. We don't always know how much snow we're going to get, but we know we should probably have a shovel ready sometimes, right? It's too early for winter jokes? I don't know.
A little early.
We're talking about this as a period of economic recovery. We're going to focus in on this green line. What makes this green line go down and what makes this green line go up? We're going to take a look, break this green line down into industry composition. This was an exercise put to me by the House Appropriations. They were very interested in what's going on in recessions. I've been talking about how, this economy has been growing, growing, growing. It's the longest period in economic history of growth, and things have a pendulum. So when is this going to, swing the other way? Who knows and why? So they were interested in trying to understand what happened in the last 3 recessions. So here is the 2007 recession broken out. Again, here's where we were in 2007. Now these are the industry compositions. And all we need to focus on is the highs and the lows, really. Because what we're talking about is percent change. You look at the top, that green line is professional and business and technical services. That's what's driving Burlington's economy. That's driving the US economy. Professional and business and technical services are business-to-business services that, if I open up an economic consulting firm, that would be professional business and technical services, but I want to focus on economics. So I'm going to hire someone to do my website. I'm going to hire someone to do my marketing. I'm going to hire someone to do my payroll, taxes, legal. All those are business-to-business services, and that is where the modern specialization is occurring. Very similar to Henry Ford when he was building the Model T. Do what you do and do it well. And that's what business-to-business services are. So when you think about the big companies that are growing right now, they're doing one thing and they're doing it very well, and they're figuring out how to partner with others, people who specialize in areas. And this is where we're going as a society. More specialized, this is kind of bridges into the gig economy where you have a skill. I can code. I don't care who I code for. I'm just going to code based on whoever's paying my paycheck this week. When we talk to young people, Sarah and I, we go out and talk to high schoolers. We're talking about how do you take your skill, your passion, and convert it into an employment opportunity to take care of yourself long term, right? For some people that works. For others, it's more of a traditional path towards skill acquisition and career development. But I'm going to highlight the yellow line is education and health services. And we're going to talk about how education and health services understand they're not the same, but they get paired together, and we'll break that down. But education and health services has had that positive growth. So during a recession, you're expecting to see downturn and recovery. Education and health services never even caught a cold. Continued growth. 2007, growing, 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 right? Some of that's public policy. As we go back, let's take a look at the 2001 recession. Yellow line. Never an economic downturn, never experienced a loss of employment from the standpoint of sheer positions filled. And you can see this one was really, manufacturing. This was the tech boom. It didn't hit Vermont very bad, but 2001, but you can see that the technology that was being created revolutionized the way manufacturing was done. And so you can see how that was tremendously impacted during the 2001 recession. Going back to the 1990 recession, the 1990 recession was considered a New England-based recession, but it was a large enough recession to take the entire country into recession, and it was driven by construction, right? So we see that a lot of times. This is a very typical thing. Construction, you overbuild, and then there's a boom and bust, right? But look at healthcare. Again, the last 3 recessions, education and health has not shown any weakness during an economic downturn. And this got me thinking when we start talking about it. The other ones you can highlight, government did okay, and that's where you'll find a lot of public education. Professional business and technical services continues to do okay, but again, that's where the modern economy is heading. So what does this mean about healthcare? What does this mean about healthcare going forward specifically? We are starting to see, like in this modern time, the conversations that are going regarding private education. So, private education is starting to show that weakness. There's been a lot of stories written about closures in that. But I put the question out there, and I love asking questions because I like getting responses. So I've talked to a lot of healthcare economists, and if I believe as an economist there's a pendulum, there's a swing to things, and makes me bring up the question, is there such thing as oversupply of healthcare? Is there? I've never gotten someone to say, yes, it's possible. In my mind, I can theorize, yes, it's possible. If we hired 4 brain surgeons and we stuffed them in the same room waiting for somebody who needed brain surgery to come in, that would be considered an oversupply of a particular specialization, right? We talk about this in economics, jamming too many resources, too many cooks in the kitchen, right? It becomes unproductive. If you had 15 ER nurses standing around one table, that's not helpful, right? But that's like a fantasy, right? We can't even fill those positions if we wanted to, but this concept of what does it mean to have, and Devin's the one who put me up to this, unfortunately, to ask this question of this group, is because it does. And I'm interested as a concept either offline or in this meeting, what does it mean? How do we actually have that conversation? Because the solutions right now, as I talked about, this labor market is so tight. I'm sure employers are trying to think, how do we do things differently, right? That's what you typically do in any industry. And I'm sure healthcare is no different. How can we make what we have work for the people we need to serve? Thoughts, questions? Tell me I'm psycho or not appropriate.
Well, I'll just say that I think the answer, in economic terms, is it depends. So what part are you looking at? What's particular services? What's the appropriate distribution of a wide range of services that are needed? Do we need 17 brain surgeons in the state spread around or not, or do we need 5? Do we need everyone who can do elective surgeries, every organization, every county to have opportunity for elective surgery, or do we shift that some other way? It'd be great if we could make those decisions in the state and go with that, but we're part of a national market. We're also part of a market of people driven by their own interests and skills. So we've got doctors who don't necessarily want to go into primary care, but they want to go into something more lucrative and they want to live somewhere else, etc. So we've got all those individual decisions that are part of the context of how we make a statewide or an organizational or regional decision.
Yeah, fair point. It makes me think, I've been partnering a little bit with healthcare providers to talk about the role of community health workers, right? Saying, well, maybe we can leverage these positions or create them so that it leverages the whole system better, right? Did you have
the Dartmouth Atlas, I think it's called, did they study this?
Did it?
Yeah, I think the example they gave was a hospital has an MRI machine, fills it. Where they did have an MRI machine before, you paid $1 million, you get an MRI machine to fill it. Some communities go and bought 2 of them, and they do twice as many MRIs as the hospital has 1. So I just thought that was interesting. And then they started looking across the country of who has certain services, and it's the field of dreams. If you build it, they'll come. And then you have overutilization.
Yeah, thank you.
In terms of regional, so I'm from New Hampshire, we have an aging population. Everyone talks about this all the time. So at some juncture, you're going to have a demand that can't be met by the current supply. So unless there's a transition of care provision from whatever it is today to meet geriatric needs, then presumably money will shift to providers of that service in an economic term.
Yep.
But in the meantime, if we have a healthcare workforce shortage, and I'd love to know how you measure that, by the way, how do you go about filling that? I mean, I think that's the challenge that a lot of people in this room have, is, okay, not just meeting the demand today, but anticipating what it's going to be.
Yep. Yeah, and that's a fair point. And I was part of the governor's workforce on healthcare work group. No, governor's
task force on healthcare workforce.
Yes, thank you. That's what I was on. And we actually hired an independent consultant to come in and talk to us about, and apply a national model they built and apply it to Vermont. And when you talk about the changing care, because there was all these ideas of like, well, maybe if we went in this direction, we would be able to save a bunch of money on healthcare down the road. And so it was a kind of like a model that built out staffing patterns, and it talked about utilization. And it kind of was depressing by the end of it, because every scenario, whether it was targeting diabetes or obesity or smoking or anything, it said that there was basically, it was a zero-sum game, but what it did is it changed the practitioners that we needed. So when you mentioned geriatric care, it made me think of that, because it said, oh, well, all the people are going to do is live longer, and now we're going to need more geriatric services, right? And so there was never this idea that there was, if we adopt this policy, we will realize a major savings, because ultimately everyone will still need healthcare services for living longer. And so I think that's why a lot of people don't talk about the report, because it makes people sad.
Since we do the workforce data collection for the state for healthcare and for 40 professions, and we have reports on our website, I'm glad to share it with anybody. And we also do shortage designations, and there's a federal model. Maybe you've heard this, we said this before. It's a federal model. Vermont, while anyone in this room who's a hiring official understands the number of vacancies they have, the wait times they have in their practices or their services, when we take a look at the healthcare, the ratio of healthcare providers to the population in a variety of professions, we see some shortages across the state, but we are not, as I say, we're not Wyoming. We're doing better. New England is actually doing better on most of those kinds of professions than the rest of the country.
The national model projecting healthcare demand for employment, the nation is just growing, growing, growing. And as I showed with our graphs, we've been actually providing for, I guess in some ways, I'm trying to think of the right word, but we have been staffing up, so to speak, in preparation for these things, and the data bears it out. But relative to the nation, we do have a higher concentration of these things. So even if we have a perceived lack of, I hope I didn't use the word shortage. I hope I didn't. I said tight labor market conditions. But you know, this idea of a shortage, right, for certain professions. And so when we're breaking down this component of health versus education services, when we've seen what's happened since the recession, the bottom of the recession, 2010, we're seeing all of Vermont employment on the far right grew 0.8, right? Education services, these are private, not public. That's public education's in government. So these are private education services, growing at 1.4%, and we know that the data in 2018 is going to be much softer on that because of the recent announcements of some major employers. But you'll see health and social assistance, which is a grouping in itself, is outpacing both of those. Right? And it's 2-to-1 relative to Vermont employment. And when you look at where within health and social assistance, you're seeing the growth. It's in hospitals, ambulatory health care, and then social assistance, less so in the nursing residential facilities, which is something I'm sure people are going to be looking at in the future. But what these little numbers in these parentheses mean is actually relative to the country, how are we? And anything over 1 means that we have a higher concentration of that employment in our economy than other parts of the country do. And so we actually have, you know, hospitals, a very high location quotient. Social assistance, you know, we're known to be, you know, very proactive when it comes to getting people enrolled in federal programs. So we believe that we have a, you know, the appropriate, or we have adequate staffing as it relates to that. But you start comparing this, our economy versus the US, and you start seeing differences, right? So even if we're saying we have tight labor market conditions, even if we're saying we need more nurses or more healthcare providers, there's other parts of this country that are experiencing a situation much different than that. And I guess Kansas is today's example. Yeah. So when we talk about all these things, so when I talked about this briefly, we get a model saying here's where the nation's going to grow. Now take this model and tailor it to Vermont. We look at, it's basically a forecast. Where is the jobs going to occur? This is by industry. And the 3 that come up all the time are professional business, technical services, leisure and hospitality, and education and health. It matches what's happened in the last 10 years. Where has the growth occurred? Professional business, technical services, leisure and hospitality, and education and health. That's where the growth has occurred, and that's where it's projected to continue to occur. As the Department of Labor, as just a fun side point, when we're talking to young people about career awareness, we highlight those 3, and then we highlight 3 others. One of them is actually twice. We highlight construction, and we highlight manufacturing, and we highlight healthcare again. And the reason we highlight those 3, construction, manufacturing, and healthcare, is the age profile of the people who work in those industries is much higher than anywhere else. And so even if manufacturing, which is projected to have declines in employment, they might be losing 10 people, but they need to hire 8 of them back. That looks like employment loss, but due to retirements, due to people, natural churn in the job place, healthcare, manufacturing, and construction, they're just trying to stay the same size at this point, keep up with retirements, keep ahead of that curve, and this has nothing to do with growth. Right? So, and we can project this all day long. We can say, oh, we're projecting growth, but if there aren't the people there to fill the positions, it never shows up in the data as a filled position. It just shows up as unmet demand, right? So, and why it's getting tougher and tougher to fill the positions, and this is where we start talking about the tight labor market conditions. There's a couple of factors at work here, one of which is demographically speaking, from a US standpoint, people in the US are working less. They don't even want to be in the labor force. So this is all data since 1950 projected out to 2060 by men and women by the Bureau of Labor Statistics for the US. And you see men used to have north of 85% labor force participation rates. Now they're in the mid-60s, and it's projected to continue to decline. Women, if you want to know why the US grew so rapidly for the last 50 years, it is because women's increase into the labor force and the incredible productivity and economic gains realized by that talented pool that was underutilized back in the 50s. But once you get to the 2000s, 2010s, you're seeing that it limited off. So even women are choosing to work less than they historically have. And we could say, well, it's a demographic issue. The US is getting older, Vermont's getting older, But when you actually look at the data at an age cohort, you're even seeing there people are working less. So mature workers, the bottom line here, had a big run up in 1990s, 2000s. They're expected to participate less. That could be considered a demographic thing as the baby boomers age out to 75 plus. You'll see downward pressure there. Young people used to have north of 65% labor force participations. That's the blue line. Now it's less than 50. It's projected to be that. Again, US data, Vermont, we have a higher labor force participation for these. But even the prime age workers, 25 to 54, we're seeing that decline across the country, not in Vermont, thankfully. And there's a lot of research. If you want to start talking about dark and sad research, look into why the labor force participation rate for 25 to 54-year-olds is declining in the US. And you will get a lot of stories about Heartland America, one employer closes, you'll get conversations about disability, about opiate use, a lot of disenfranchisement, a lot of disengagement. And that's, as I said, not showing up in Vermont data as of yet, but for parts of this country that is a real crisis. The baby boomers were first eligible to start retiring, I believe, in like 2007-ish. Right? And that was right at the cusp of the economic downturn. And so we saw that when the economic downturn happened, people stayed in the labor force longer. And as actually we reached record high labor force participation rates and sheer numbers of people in the labor force in 2008, 9, and 10. And then once the economy started improving in 11 and 12, we started seeing the mass exodus of people with pent-up demand for retirement. And so they are participating, mature workers are participating at a higher rate than they historically have, but it's not projected to continue. So, and you have to, where it becomes like a numbers game. When you're 54, you have an average participation rate of upwards of 80%. As soon as you become 56, then you're down in this 40%. So it's the drop off between a large cohort of people moving through. And so even though they are participating in more and they're growing in sheer numbers working, it is just that it's a numbers game with that big population going into a much lower cohort. And that's the funny part about data. A couple of things. You'll look at this, and so first with the rural and urban, there's been a lot of discussion about what's happening with the rural and urban. And if you look at the history of it, it's like places that used to be rural that have grown and grown became urban. And so they get redefined. And so you have to look at how actually these articles are characterizing the rural and urban, because I've seen it, well, if you back out all the people that are now considered urban that used to be considered rural, you can actually see there's been a tremendous amount of growth in these areas, right? And the same thing for these things is you're looking at people 10 years ago, what were the employment outcomes, what was the income outcomes in 2000 versus when it's going to be in 2020. You're talking about different cohorts of people and different quantities of those people. And so you're seeing that right now in these discussions that are going on about income inequality. You'll see the way the data is presented. They'll compare things 10 years ago when there was a high labor force participation rate or a positive economy, and then you have people transitioning more into part-time work, encore careers, or even retirement. And that's really going to impact the conclusions of how that data is presented. So Homer Simpson was right, like statistics, 95% of the people know those aren't worth anything. So this is why we're seeing the pressure as far as the labor market. Americans are working less, and maybe some of it's good news, right? It's not all to say this is all bad news. Maybe people are going to school more. Maybe people are more independently wealthy or able to make ends meet through other ways than traditional work. But this is why we're talking about the labor market conditions, because of this ongoing economic expansion, the need for things like healthcare, and how do we figure it out. So I was just going to jump into a couple things, and I'm going to turn it over to Sarah about what my division's been doing. We're worried about the public narrative, this idea there's no jobs out there that pay well. Believe me, if we want to make all the young people leave, that's a great narrative to start spreading, right? That's a surefire way to fulfill our destiny. And the conversations about young people today, it's a challenge, whether you're talking about generation or there's no young people out there. Well, some of that is related to birth rate. The state of Vermont is a very low birth rate. We've had a low birth rate. We're like second, third lowest in the country, and we've had that for 30 or 40 years. Well, guess what happens if you have a low birth rate for 30 to 40 years? There is literally fewer young people out there, and it does look like it when you look out there. and that as a function of how we're aging as a society. But lower birth rate is typically correlated with higher educational attainment levels, higher employment, and we see both of those here in the state of Vermont. And so what's good, what's bad, I'm not here to say any of that, I'm just saying kind of what is. And so this idea that young people are carrying around a message that there's no jobs in the state of Vermont is not helpful for anyone. And so the Department of Labor, we talk a lot about that, and how do we get young people to reframe the conversation to what are the opportunities in the state of Vermont? Because even I grew up here, and I never would have thought that the jobs that I eventually got in the state were here, because I had no way of knowing they existed, right? So there's just a lot of small firms out there doing really great work, and they're not always known about. So we started thinking about what's the employer's hierarchy of demand? What do employers need? And we started asking. We called employers, and they kept giving us the same answer, and eventually it just became this pyramid where we need more of the skills at the bottom, but the more skills you have, the higher skills you have, the higher you'll pay for them, right? So brain surgery, we need one right at the top, right? And then we're going to give that person huge. You can throw a 100-mile-an-hour pitch with tremendous accuracy. Oh, we're going to put you right at the top too. That's a $20 million a year job right there if you can do that. But we only need a couple of you, 5, to be successful in our team. Red Sox have currently 0. If anyone's fine. They have plenty of $20 million players. They just don't have anyone who's throwing 100 with accuracy. So we started labeling this out. Oops, did I go the right? Oh, yeah. And so the cautions before we get into this, because it's easy to simplify. Oh, it's easy to simplify. We just need this. We just need that. But we have to remember that as skills rise, so do wages. So we're trying to create and reinforce that message. The more skills you have, the better your opportunities are going to be. The more you can do for yourself, the better off you're going to be. Technology has really disrupted the original pathway, right? There are young people today, there's people in this room that have tremendous expertise in certain skill sets, right? Maybe someone speaks Dothraki here. I'm not saying that's going to be identified or desired by the labor market, but it's a skill that you can possess. And you didn't have to learn any other skills to get there. So you'll find, when I work with young people, sometimes they can't show up on time, but boy, can they program a computer, right? Or they could build one from scrap heap parts. So incredible ways to get skills. But there's individual solutions, multiple pathways to success, and we cannot define other individual's ceiling, right? People can always continue to grow. But basically what I've learned or believed to be true is the hierarchy for employers is they said the same thing over and over again. We need 3 things. We need someone who can show up on time, work well with others, and follow instructions. If you can find me someone to do that, I will put them in a job. I will get them in a training program. And healthcare, bless its heart, is one of those industries that has done very, very well in figuring out how to create career pathways, right? There are opportunities. We will get you in the door. We will make sure you can do these 3 things, because the first job you're going to have is going to basically be show up on time, work well with others, and follow instructions. After that, we will get you the training. We will get you the problem-solving skills. We're going to figure out how you can show responsibility, demonstrate initiative, and eventually get you into certificates, degrees, whatever it might be to be successful in this industry. So we're really trying to drive home this concept of, there's people out there, they need to have these skills. They need to communicate these skills to employers that I can show up on time, I can work well with others, and I can follow instructions, because that's of tremendous value, and employers are saying that's what they need. In these tight labor market conditions, employers have never been more at the table saying, we will work with anyone who has those 3 characteristics, we'll train for the rest, right? Whether it's manufacturing, whether it's construction, we'll train for the rest. So one idea, I have brochures, or maybe Sarah handed them out. Thank you for doing that. This is an example. This is our 3rd-year partnership, trying to highlight the employment opportunities in the state of Vermont. There's a whole category which healthcare falls into, which is under the observe, learn, analyze, and solve problems. You'll see many of them, and I highlight these when I talk to young people. We do would you rather games. You ever played that? Would you rather? Would you rather drink a puddle in the parking lot or mow the grass with your teeth? Who wants to drink a puddle in the parking lot? Health people, right? Yeah. Mow the grass with your teeth? Now, you obviously haven't played this game. You have to choose one. That's the game. So the one that I get young people do everything from would you rather cook dinner or do the dishes, and I translate that. And these are skills right now in demand. In a hospital, you need people who can do dishes. You need people who can cook. There's big employers. But the one that I get people to think about is would you rather do someone's taxes or clean someone's teeth, right? because both of those require a high school degree and a 6-month training program, at which point you are in a career pathway to independent success and economic independence and success, right? So it blows people's mind to think that they could have a career with 6 months post graduating from high school, right? So I just thought of that because the dental hygienists are on there. So, Sarah, will you come up? And as I'm wrapping up, going to talk about we're workforce development, Sarah's division. We're doing partnership in recovery centers and providing reemployment services on site. And I will let you drive from here.
All right.
My name is Sarah Buxton. I was appointed by Governor Scott a couple of years ago to lead an effort with other folks in his administration to work on expanding the labor force in the state of Vermont. We have a serious labor force shortage, and it's going to take a lot of different strategies and a lot of different approaches to try to work on how we can expand the labor force and strengthen it while we go. So before I go much further, I want to get a sense so that I can tailor. Workforce development falls in a lot of different buckets, everything from training to matching to recruitment to retraining, upskilling. Can I just get a little sense here? How many of you are direct practitioners of healthcare? All right. How many of you work in administration? How about HR? How many of you work somehow in have an interest in training programs, talent pipeline, talent acquisition? Okay. And I know you said you're from Southern Vermont. Anyone else from Southern Vermont? Great. Central Vermont? All right. Chittenden County? All right, it's okay. Anyone from the Northeast Kingdom? Great. And outside of Vermont? Did I miss anything? Yeah. Great. Well, so I'm from Tunbridge, and just so you know, the Tunbridge Fair started yesterday. It goes until Sunday. You should definitely make it down to see all the wonderful things there. Okay, so Governor's priority, when he came on, he made increasing the size of our labor force a top priority. And so I was asked to go and work across all the state agencies, everything from Agency of Natural Resources to Agency of Education, Human Services, Corrections, Transportation, Public Safety, and come up with a comprehensive plan based on what we're already doing or initiatives that were already in the works across state government to figure out what we could do and try to work together, leverage one another's efforts to increase the skill and the number of workers in the state of Vermont. So for many of us, not just in state government, but now extending to our partners, we're all beginning to try to work together and figuring out where we fit in this large goal of increasing the number and the skill level of workers in Vermont. Basically, this falls into 3 strategies. The first, as Matt has just talked a lot about, is increasing the labor participation rate of Vermonters. Okay, I just want to pause on this a little bit because there are 2 cohorts in terms of age when we think about increasing the labor force participation rate of Vermonters that my division has really started to focus on, and we've been looking across in state government, and that is the 16 to 24-year-olds, the youth. We started a Vermont Youth Employment Program this year where we have secured some flexible funds to try to leverage some federal dollars in getting young people work experiences. So think about where you are, whether you're someone who is hiring right now or have any interest in trying to work with a young person, training even with your own job. We are able to match you with a young person and provide wages. It's minimum wage, but right now what we found with a lot of young folks, 16 to 24, is the experience of working helps them to create a habit of working. So just know that resource is available. Call us at the Department of Labor. I'm happy to connect you with our local offices and see if you can't also be part of us trying to create those pipelines. We also experimented with a new program last year, or 2 years ago, that we created called the Returnship Program. Initially, we had thought about the returnship program being almost like an internship program, but for individuals who already had experience with work. So this could be for a parent who's taken some time off after having a child or having taken care of an elderly parent or relative. It could be a veteran who's returning from a deployment. It could be someone who's been in recovery and is trying to get back into the workplace. And so we do have a program right now where we are trying to put people who already have work experience, and to show you a little bit on Matt's chart here. Basically, these are folks already who've been able to demonstrate level 1 competencies, and you're not having to do that through an internship. And we're putting them in employment experiences where they're able to hone in a little bit with level 2 and level 3 competencies, so that they may be able to eventually fill a job that you have waiting for them, or they're creating a little bit of experience on their resume to then go and to find a like job in a similar occupation. So the labor force participation rate is also incorporate some of the other activities we have with helping individuals who are reentering after a time in prison. So we're trying to work really carefully with the Department of Corrections in being able to offer more intentional trainings inside of the facilities, and be able to give them a pathway for when they're released into work in the occupation they've been trained for in prison. Couple things that you should know about, if you're in hiring, or if you want to pass along some little tips and points of information to those who are. We have 2 programs that you might consider taking advantage of, little incentives. If you are interested in hiring someone who has a record, perhaps embezzlement or identity theft or something like that in their background, or perhaps a veteran who's been dishonorably discharged, we are able to give employers free of charge access to some bonding, so that it gives the employer some sense of security. For the first 6 months, we can bond up to $25,000 a person, so that you can take an almost risk-free chance on a new worker when we're trying to help them get a second start. So again, that's a tool that not many people are aware of. So these are fidelity bonds that you can access through the Department of Labor. You can also access work opportunity tax credits for hiring a whole array of people who have barriers to employment. So a veteran, for example, who's been out of work for 6 months, an employer hiring an individual in that category could receive up to $9,400 in a tax credit for that hire. If there's a person who's on TANF, temporary assistance for needy families, in Vermont it's called Reach Up, or on SNAP in Vermont, 3 Squares Vermont, you can get a $2,400 tax credit. There are a variety of other levels in between. If you're an ex-offender, I had already mentioned the fidelity bonding for that. There are disadvantaged youth tax credit opportunities. So, you know, these are just some things that I think employers don't really know about when trying to access, you know, folks who could be really good workers in a tight labor force. So we're working on trying to promote those opportunities with Vermont employers in order to help increase the labor force participation rate of Vermonters. We're also looking to, and have been successful at, receiving some federal funding for expanding apprenticeships. And in the last year, we've received about $1.5 million to expand a number of apprenticeships. About half of them we're developing in the healthcare field in partnership with CCV and VTC. If you're with Brattleboro Memorial Hospital, you're probably very familiar with some of the work with CCV that we're helping to support down in Brattleboro. We're trying to bring those apprenticeships in the medical assistant and then with VTC, an LPN apprenticeship. And we're bringing that up into Central Vermont. I think CVMC, I think there's some current conversations with Copley and with Porter Hospital also to see if we can find ways to bring the apprenticeship model into the healthcare realm and make it something more viable. So this brings funding to the table that would pay for the related instruction, for which the individual also gets college credit, since we're working with CCV and VTC, and it allows them to get in that pipeline into the healthcare field. I'm trying to think if there are other populations that, New Americans. The I'm not sure how many we said were from Chittenden County. I think there were some. We don't really have a strong New American population outside of Chittenden County, but we are working with University of Vermont, and I believe it's CCV also, to try to do some specialized nursing programs for new Americans and help them find their entry into the healthcare professions. The second strategy is to recruit and relocate more workers to Vermont. You've heard a lot about this in the current administration's plans to provide incentives for individuals to come to Vermont. We at the Department of Labor are also heavily engaged in a new initiative with the Vermont Air and National Guard. Been already had one trip to Fort Drum, and we'll be planning another trip next month. And I'm going to talk a little bit more about that in a second, because I want to see if there's some interest in any of you in separating service members. The third thing we're doing is assisting employers in accessing and retaining qualified workers. So an underutilized resource in the state of Vermont is the Department of Labor. We can take your job orders. We have a federal funding stream that we have labor exchange staff, people located all over the state, to work with you as employers. We can take your job orders, we can post them. They'll get picked up by places like Monster and Indeed. So that's another way for you to know you don't have to pay to have your job posted. You can put it through this free system. This system is also connected to all of the individuals on unemployment in the state of Vermont. So when they're looking for and having to go through their job searches, they are having to look at our what's called Vermont Job Link. We can do hiring fairs for employers. We can work with you on population-specific hiring events. We can also work with individuals and employers to help you beef up your job descriptions. We can help individuals with practicing interviews and helping them with their resumes. So if you are getting folks who are applying for jobs and you're finding that they're not quite what you're looking for, and you feel like a little professional development, maybe some training, maybe some support in accessing that first tier of skills that Matt had noted earlier, we have staff who can work with them and can try to help get them to a place where they're really ready for work. So the approaches that we've taken to try to meet that goal of increasing the skill level and the quality of workers in the state of Vermont hits all of the regular boxes. We're working together, we're staying focused, we're trying to coordinate. And as you all know, that type of work just takes time, and it doesn't really, it's hard to show the impact of some of this important work. I did already go over quite a bit with the labor force participation rate of Vermonters. We're doing some interesting career coaching activities down in Windham County and in Rutland County. We've got some job coaches now going into Mill River and into Otter Valley and trying to help students find those career paths through the technical center and local colleges, and then stay in the health-related fields and other fields in Rutland County. So if you're from Rutland County, let us know and we'll connect you with some of those job coach activities, because they are eager to make sure that the employer's needs are being met. We are trying to increase qualifications and capacity of both child and elder care workforce. So child care workforce, something that probably doesn't even need to be said, how dire that workforce need is and what that shortage looks like. Elder care workforce is similar, and the real challenges there are the pay. Talked about apprenticeships. We are trying to increase funding for tuition and costs of non-degree credentials. So enhancements to some of your licensing, that's starting to pop up a little bit more for incumbent workers. The Department of Labor doesn't fund as many things with incumbent workers, but we are partnering pretty closely with the Agency of Commerce and Community Development that does have funding in that way. So if you are trying to upskill your current workforce, we may be able to provide some connections and some support there. Okay, recruit and relocate. There are just two things I want to point out here. I want to talk a little bit about military base outreach, because I'm really excited about it, and about the relocation assistance that is coming our way. So General Knight approached us about 18 months ago and said, National Guard is really needing to recruit more members if we're going to keep the Guard here in Vermont. A couple of statistics here. 2,200 service members leave or separate from service at Fort Drum every year. About a third of them go to their home of record, a third of them stay somewhere in New York, and a third of them are up for grabs. So if you think about it, that could be 700 highly skilled individuals where if we could find the right space for them here in Vermont, they and their spouses, we could really do a lot to support our community. So I don't have a lot of familiarity with the military, so I didn't really know what to expect, but I was really inspired by the 3 hours I spent speaking with these individuals who ranged from, early, mid-20-year-olds who've been in just for a couple of years and said, I've done my time, I'm leaving, to individuals who were in their late 30s and said, my spouse has said, I'm done, I'm leaving. They've served 15, 20 years, to folks who were serving 35 or 40 years and were looking to retire and were very skilled but only had, in their view, on their record, a lot of military experience. And so taking these resumes and starting to have some of these conversations was really inspiring. I found that a lot of their spouses were in the healthcare profession, so I said, what would you like to do? One gentleman said, it really doesn't matter. My wife's an RN, and wherever she can get a job, I owe that to her. So I found that there were a lot of conversations about their spouses and about where their spouses wanted to be, where they wanted their children to go to school, asking them questions like, do you want to live on a dirt road or a paved road? Many of them were fine with saying, I'd be happy to live on a dirt road, which to me meant that our rural landscape here in Vermont is something that could be a great fit for them and their families. The other thing I noticed was the diversity in the individuals that I had met. Being from Vermont, I expected to see a lot of white people. About half of the people I spoke to were people of color and weren't necessarily interested in going home to the South or to the Midwest or back to Texas. Had really enjoyed and had been acclimated to winters in upstate New York. So I see a lot of promise there. And so I'm saying this because if you have an interest as an employer or employers that you work with, and partnering with us to specifically go to the next career fair, I think it's in November, and then working with us on how to structure a healthcare specific. We've gotten permission from the base to go this fall, or actually it'd probably be early winter at this point, and do a healthcare specific job fair. I think we could get we would have a lot of interest, and I'm pretty confident that the cost of traveling to Fort Drum and doing this is probably less than putting an ad in 7 days again for you. So just let me know what you think. The other thing I wanted to let you know is we have met with some of the associations here who represent healthcare providers, and they've noted that of their challenges in trying to go to the Boston and New York markets and recruiting professionals is the trailing spouse or the talented partner. We have been designated by the legislature and by the governor as the department responsible now for putting together a relocation assistance program. And so starting October 1, we're standing up at least phase 1 of what will be a comprehensive one-stop shop for anyone who wants to come to Vermont, but also for you who are recruiters and have found that specialty surgeon that you're looking for in Boston, but realize that your specialty surgeon isn't going to move here to Vermont if their microbiologist professor wife can't find a job. And that's an area where we are creating capacity and some organizational structure to be able to partner to help in those efforts with private recruitment initiatives, but also, again, to respond to what we hope will be an influx of people wanting to move to Vermont when we begin to spend some of the marketing dollars and make some of those new incentives available. So lots of opportunities in Vermont. We've learned more skills lead to higher wages. We have a lot of information, a lot of resources available. As Matt said, we are his division is 100% federally funded. My division is about 97% federally funded. So these are resources that the federal government makes available for employers and job seekers all around the country. We're trying to do our best to really tailor it to what Vermonters need, and are open to ideas and suggestions and just general complaints if you have them, because we are in a problem-solving mindset, and we'll try to take your complaint and turn it into a win. So I won't keep you any longer. Thank you so much. I really enjoyed coming today. Great.